So today we'll be learning about the screening test for cervical cancer. So what are the options of the screening test? The screening test options are pap smear, liquid-based cytology, HPV DNA testing, which is the best screening method, VIA, that is visual inspection with acetic acid, and VILI, which is visual inspection with Lugol's iodine. Another thing, modification is that is VIAM, that is visual inspection of with acetic acid under low power microscope. So now we'll be talking on the pap smear. So before taking the pap, what are the prerequisites that we have to know? Now the pap smear should be taken after following this prerequisites. These are avoiding coitus for at least 48 hours, avoiding douching, avoiding parvaginal medications, parvaginal contraceptives, vaginal tampon use for minimum of 24 to 48 hours before the test, and treatment of any cervicitis or vaginitis. Then coming to it, after fulfilling these prerequisites, now what are the three types of plastic devices for taking the sample? The three types of plastic devices are, one is a spatula, the wooden spatula, which is the air spatula, which is used to take the sample from the ectocervix. Now there is a endocervical brush or the cyto brush, which helps in taking sample from the endocervical canal. And the third is the broom, which looks like this. So this is the broom. Okay, so this is the broom. It can take sample from both ecto and endocervix. Okay, so this part will go inside the endocervical canal and will take sample from endocervix, and this part will take the sample from the ectocervix. Now as we have told, the spatula is used to take the sample from ectocervix, brush is used to take the sample from endocervical canal, broom is used to take the sample from both. Now after taking the sample, how much of the glass slide is to be smeared? Half to 2/3 of the glass slide is to be smeared. And what is the fixative use? The fixative is 95% ethyl alcohol plus ether, and the fixation should be done at a distance of 12 inches, 10 to 12 inches. Okay, and after taking the sample, it is sent to the lab, air dried, then it is stained with Papa-Nicolau smear, and then the results are reported. But during all this process, there is wastage of the cells. So how much of the wastage? 80% of the cells are wasted, and this is the reason why liquid based cytology is preferred. Now what is the sensitivity of the pap smear? The sensitivity is 60 to 70%, while the specificity is 98%. Now coming to the liquid based cytology, which comes in the questions. So what happened? So we'll take the sample and then we'll dip it in a liquid fixative. What will this liquid fixative do? This liquid fixative removes the excess of the blood, the impurities, the mucus, debris, inflammatory cells, and then it is sent to the lab safely. And now these suspended cells are then pressed onto a filter membrane. What will it do? So this will filter the cells. It is pressed on the filter membrane, which again then pressed on a glass slide to make a monolayer slide. So this monolayer slide is then stained and the results are reported. So what are the advantages? It produces a more representative sample, less contamination because there is less blood, less mucus, less debris, less inflammatory cells. It reduces the inadequate sample collection rate, and the same sample can also be taken for HPV DNA testing. So what are the things? So pap smear should be taken after 48 hours of sexual intercourse, vaginal tampon use, parvaginal contraceptive use, after the treatment of cervicitis, vaginitis, etc. Then what are the plastic devices? It can be spatula, it can be broom, it can be endocervical brush. Then half to 2/3 of the glass slide is to be smeared. Then the fixative, it should be 95% ethyl alcohol plus ether. It should be fixed at a range of 10 to 12 inches. Then it is sent to the lab and reports are taken after the staining with the Papa-Nicolau smear. What is the sensitivity? It is 60 to 70%. Specificity is 98%. But 80% of the cells are wasted. Therefore, liquid-based cytology is preferred. Now, what is the initiation of the screening? The initiation of screening, when we should start initiating? So, initiation of screening, ideally 21 years. Ideally 21 at 21 years. the screening should be started in the low risk woman or average risk woman, irrespective of the sexual history, orientation. However, if the patient is of high risk or immunosuppression, or patient is HIV positive, then screening can be started as soon as the diagnosis of HIV is made, and then the screening is reported in every 6 months, repeated in every 6 months. Now, what is the screening interval? Between 21 to 29 years, every 3-yearly interval screening to be done. Beyond 30 years to 65 years of age, 3-yearly screening can be done, or co-testing can be done with HIV every 5 years. Now, in women with HIV or immunosuppression, annual cytology screening is done. This is the exception. In others, 3-year screening is done. Now, what is the screening discontinuation? So, beyond 65 years of age, in average risk woman, that is with no risk factors for cervical cancer or then after adequate screening, the screening can be discontinued. What is adequate screening? Adequate screening is what? And inadequate screening, the 3 consecutive negative pap smear reports or 2 consecutive co-testing reports which has been done in the last 10 years, while the most recent one has been done in the past 5 years. Now, women with prior treatment for CIN2 or CIN3 or cervical cancer, they have to continue the screening in the routine method for at least 20 years, because there is remarkable and long-term risk for developing the disease. Now, for HIV positive patient, it is uncertain that when the screening is to be discontinued, because there also exists lifetime risk of developing this cervical cancer. Now, what we'll do when the screen results come positive? When the screen results come positive, we have to take the colposcopy guided biopsy. Now, if HPV DNA comes positive and pap smear is normal, then what is the thing we should do? We should do the high risk HPV DNA testing, and then again, if it comes to be positive, then we have to take colposcopy guided biopsy. If it is negative, then we have to do the repeat testing within 1 year. Now, in screening, in which if it reveals there is any type of abnormality like low grade squamous intraepithelial or HSIL or ASEH, then colposcopy guided biopsy should be taken. Now, in the cytology, if there is ASCUS, that is atypical squamous cells of undetermined significance, which is the most common cytological abnormality, what should be done? HB triaging to be done. What is that? In which includes what? High risk HPV DNA testing to be done. If it again comes to be positive, then colposcopy to be done. If negative, then repeat testing within 1 year.